Welcome to Doctors on Call. I'm Jenna Miller. Physical therapy is a practice that's been used for thousands of years. It involves treatments that focus on prevention and management of injuries or disabilities. Physical therapy helps to relieve pain, promote healing, and restore function and movement. Like any other form of healthcare, there are a number of specialties that address different types of injuries and various parts of the body. Physical therapy, that's our topic today on Doctors on Call with our guests, physical therapists Troy Herrman and Kerby Rice.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from Gove County Medical Center in Quinter. Healing through caring. Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A Value Kansans Trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Russell Regional Hospital, experts, neighbors, friends.
In Kansas, he attended Fort Hays State University and graduated with a degree in biology. Troy then received his Master of Science degree in physical therapy from the University of Kansas Medical Center. After working in St. Francis, Scott City, and Hays, Troy Herrman created Herrman Physical Therapy and Wellness in 2017. Kerby Rice went to high school at Smith Center. He graduated from Sterling College with a degree in athletic training. He then attended Wichita State University to acquire his Doctor of Physical Therapy degree, graduating in 2016. Kerby has spent his last 4 years working in Hutchinson as a physical therapist at Pinnacle Rehabilitation and Sports Performance. Kerby enjoys working with all types of patients, but specializes in orthopedic rehabilitation and sports injuries. He is also certified in dry needling. Give us a call at 1-800-337-4788 toll-free with your questions about physical therapy today on Doctors on Call. Doctors on Call brings you information which may be useful to you when you see your own physician or therapist. Thanks so much for joining us tonight. We're going to go ahead with some questions before we get to those calls. First of all, let's talk about why patients need physical therapy.
Yeah, physical therapy can be beneficial for a lot of different physical ailments. We see people post-surgical rehab, individuals maybe that just have back pain or knee pain. They maybe get a doctor's order for those things, maybe they don't. But a lot of different physical ailments to help people get out of pain, get back into normal function in daily life. I don't know if you want to add anything on that, Kerby?
Yeah, sure. One reason that I think and I'm very passionate about physical therapy is oftentimes the symptom or the site of pain where you're having your pain at is just that. It's the site of pain. It's not the area where the problem or the origin of the pain is. And so I think that's something that our profession is really good at, and what we're all about is not necessarily just treating the symptoms, but treating the cause of the symptoms to prevent that and improve how the patient's doing.
Excellent. You mentioned, Troy, about a doctor's referral. You said maybe yes, maybe no, so you do not have to have a doctor's referral to see a therapist.
That's correct. And we used to, back when I started, before Kerby was even thinking about doing physical therapy, you did have to have a doctor's order for physical therapy. But it's been 5 years, 6 years maybe now. They've taken that away in the state of Kansas, so you can see a PT direct. And you can go in and they can assess you and treat you, and most insurances go ahead and cover that service as well. So that's a huge breakthrough for us.
Sure. Now, what problems might a person be experiencing that they might want to go see a physical therapist?
Physical therapy can really treat a lot of things. We can see people and focus on prevention of injury, which is the best treatment is preventing an injury. We see people after they have a surgery to get them going on their rehab, get them back to their job, their sport, the activities that they're passionate about. Kind of like I talked about, we see them, they're having pain in one area, see if we can address limitations or dysfunctions at another area that may be causing that pain. So several different realms that the profession of physical therapy has to offer.
Excellent. Now, is there such a thing as a physical therapist who is not licensed?
No, I mean, if you're a physical therapist, you've gone through an accredited program, and then you go and you take your boards, and that you become a licensed physical therapist. You can't practice necessarily if you're not a licensed therapist. So.
And how does a person go about finding someone who they feel is qualified and able to help them?
There's Google now, right? You
Sure.
Google anything. So you can Google. You can see ratings on those therapists when you Google, and there's also a source through the APTA called Find a PT, and you can just search in Find a PT. It'll bring up the PTs in your area. It'll bring up, you can even look and see what's that PT specialist. Like say they were wanting to look for somebody that had an athletic training background, more sports oriented, then they could go and find that individual that posts those credentials on that Find a PT website.
Can the benefits of physical therapy help avoid someone having to have surgery?
I think absolutely. You go ahead and you have a surgery for pain relief. Physical therapy, we're oftentimes able to treat and relieve symptoms to potentially avoid a surgery. If you're not having pain, if you're not having symptoms, then I don't think it's necessary to go ahead with a surgery if you're not having intense pain. Another thing, a lot of times, as we age, there's common degenerations or things that happen to in our body that are normal. One of the most common post-operative cases or diagnosis that we get in is a rotator cuff tear. Someone who's had surgery and a rotator cuff repair performed. There's some research studies out there that suggest or show that as we age, whether you're having pain or not, if you have a rotator cuff tear, or if you have an MRI or some imaging performed, there's a strong chance that you will have a rotator cuff tear present on the imaging without even having painful symptoms present. So just because an imaging shows something or suggests, or the next step is often surgery, doesn't necessarily mean that that's the next step that you need to take. I think there's other options available before you go to what I feel like is the end or the last resort in having a surgery.
If I could add to that a little
Sure.
bit, yeah, what we as a profession really want to do is take any of those individuals that have those physical ailments and have them see PT first, right? Your shoulder hurts. What do? You go to a musculoskeletal specialist. That's what physical therapy is all about, and it's the most conservative form of that. We definitely need surgeons, right? There are a lot of things that we have out there that need fixed with surgery, but like Kerby pointed out, some of those things like maybe a rotator cuff tear, maybe a meniscal injury to the knee, maybe a herniated disc in the low back. Those type of things, research is showing us that maybe more conservative care is the way to go, because years down the road, those people are in that same boat, and a lot of times that surgery may not be necessary, at least initially.
Okay. All right. Very good. We're going to go to the phone lines now. We've got Lindsay on the line from Russell. Hi, Lindsay. Go ahead with your question for our physical therapist tonight.
Hi. I'm wondering what you could tell me about scoliosis. If you could help. My son has been told that there's possibly something there, and I've never had him tested or anything, but I didn't know if he would need to be diagnosed with that, or if you guys could help with that. What can you tell me about that?
Yeah. You want that, Kerby? You want me to tell you?
I'll have you go ahead.
Okay.
And I'll
yeah.
add in.
So, and he can add in here. So, first of all, there's several different types of scoliosis. Most of those could be observed just by looking at the patient without having imaging. If you want a more accurate picture, you can have imaging, but you wouldn't have to start there. And it's often something that you want to monitor. you can be given exercises and stretching and strengthening things where you can try to create any muscle imbalances that may be occurring within a scoliosis. A lot of it's to do with education. And I think that's where, as PTs, we get to spend a little more time with our patients than some of our counterparts. So we get to do a little more education with those individuals and teaching them how to manage a condition rather than getting a fix for a condition. And a lot of that's, we want to change that mantra, I guess, if you will, of anytime we have an issue, getting it fixed. We need to learn to manage. We need to learn to cope with what we have, and as long as we're functional and our pain is fairly under control, then we're usually okay to go.
I don't think scoliosis by no means, especially in that adolescent age range, is, it's a fairly common thing. And what I've seen with my experience is oftentimes, when pain is associated with scoliosis, it's not necessarily the spine that's causing the issue. It's kind of secondary effects. With the curvature, sometimes you can have a person who has kind of a resting abnormal posture where one shoulder can be depressed as compared to the other, which can kind of predispose you to have some shoulder injuries or overuse things with the shoulder. Same thing with the hips. So I feel like a lot of the patients that I see, scoliosis is maybe part of the reason, but not necessarily the reason they're in for PT or where their pain is at. It's oftentimes secondary or somewhere else.
But PT would be, I guess, in short, a great place to start with a diagnosis of a scoliosis.
Okay.
Yeah, good question.
All right, we're going to go back to the phone lines now.
Okay.
We're going to talk to Ron from Abilene. Hi, Ron. Go ahead with your question for our therapist tonight.
Yes. What is the difference between dry needling and acupuncture?
Yeah, so great question. Get asked this a lot. Kerby and I are both certified in dry needling. I've just been since July, so some of it's still a little bit new to me. But the main difference is in theory and approach. We still use acupuncture needles, but we use them more specific to a specific nerve impairment or a specific musculoskeletal impairment, as opposed to treating kind of the body as a whole with acupuncture and hitting all of the several points and balancing someone's energy or chi, whatever it may be. It's more of an Eastern medicine type approach, where dry needling is more of the Western medicine. All right, I've got a tendinopathy, I'm going to go in, I'm going to needle that area around that tendon to try to help reduce spasm and improve the neuromuscular response.
I think dry needle is much more specific than what acupuncture is. When we palpate or feel, we find areas or muscles that have what we call trigger points, and the muscular pain is one of the most intense, uncomfortable, aggravating types of pain when it's of muscle origin. With dry needling, we're able to target that area, target that tissue, get in there and oftentimes see results within 24 hours or improvements within a day or so. Acupuncture, kind of as Troy touched on, uses more of a mapping, or if I place a needle here, I'm going to sink in the chi energy, and that is going to perform the healing. So I feel dry needling is quite a bit more specific and get right on the area that is causing the pain.
Who might be a good candidate for dry needling?
I let Kerby chime in after I chime in here, but so my individuals that in the short time that I've been doing it, that I think most benefit from dry needling are somebody with maybe a severe muscle spasm, somebody, like I mentioned, a tendinopathy, where a tendon's just not working like we want to, neural type pain patterns, where somebody maybe has sciatica, pain running down the leg. We go in and we can dry needle those areas specifically. It's not the first thing that I go to most of the time. But after I've seen somebody a few visits, if they're not responding maybe to that, then I might jump to dry needling. Or if they've had, a benefit from dry needling in the past, then I might jump to it a little bit sooner.
One of my favorite areas to dry needle is the upper trap muscle in this area. I'm sure there's many people out there listening right now that that area is just super uncomfortable to them. That's a quick, easy area that we can dry needle, and like I said, oftentimes within 24 hours, oftentimes less than that, people are getting relief and are much more relaxed and not near as spasmed or tight or uncomfortable through that area. So that's definitely my area to probably dry needle.
And Troy, you mentioned sciatica. What is sciatica and what are the symptoms?
Well, and that's a great question. Sciatica in and of itself is a symptom. A lot of people use it as a diagnosis, but it is a symptom. It is pain that is running down your leg, and there can be multiple causes for sciatica. You can have bulging discs, you can have a restriction in one of the joints in the low back, you can have a restriction or tightness in the pelvic region, maybe with an SI joint, or maybe you have tightness of the piriformis muscle. I know I'm throwing out a lot of different names, but the point is, and Kerby alluded to it earlier, one of the key things that PTs do is, okay, this individual has sciatica, why? So we run you through a lot of special tests and try to decipher, okay, what's causing the sciatica, and then address that and treat it. So.
And kind of like as I mentioned beforehand too, a lot of times the symptoms of sciatica can show up all the way down in your lateral shin area, down your lateral ankle, all the way down into your foot. And we'll have people come in all the time saying, I have this pain on the outside of my leg. And as we get to kind of question them or quizzing them a little bit, we will be able to kind of trace that all the way back up to the back level, even though they may not have a lick of pain or a trace of pain in their low back. So yeah, kind of a broad, large area that symptoms of sciatica can affect you.
Okay, we're going to go to the phone lines now. We've got Karen on the line from Paradise. Hi, Karen. Go ahead with your question tonight.
I took a fall a year ago in January, and I have done physical therapy, I have done chiropractor, I have done dry needling, and I'm still walking with a limp and suffering quite a bit of pain. I finally had an MRI, and they say I have a bulged disc. So that's my question. What do I do? Thank you.
Yeah, so we talked about this a little bit earlier. The first thing I would have you do is, if I were to see you, I would have you come in and we would look at your MRI. We would look at you as far as the special tests are concerned and run you through an evaluation. And we would need to find out, does the level that the bulged disc that occurs, that they're showing on the MRI, is that coincide with the symptoms that you are having? And if we can say that, yes, this bulging disc is putting pressure on the L4-5 nerve root, I don't know which nerve root you had, or if they were saying there was even any stenosis there. But let's say that it was, and then we said, well, okay, and you're having pain down the lateral part of the leg, and that's what's causing you to limp, or if we can, I don't know the word I'm looking for, but if we can say that pain that you're having coincides with that level of the injury, then we would treat that disc. There are different ways you can do that. You can do it through manual therapies to try to move the joints around. You can do it with spinal decompression and or traction, which I do utilize that as well. We want to try to calm the nerve down, which if you're doing that the right way, you can do it with dry needling and or soft tissue work as well. Kerby, you want to add some of your intellect to that one?
Yeah, that's definitely a tough case. And one thing I want you to know is that you're not alone. There are many people that have similar situations as to yourself. One thing, and unfortunately we don't offer it at our facility, getting in a aquatic environment or a pool type environment kind of works wonders sometimes for these chronic pain patients, where you've had pain for some time and nothing seems to be working. So that may be something that I would say to try or give a whirl, is to start with some water or activities in an aquatic environment. See if you can progress your tolerance and progress your overall physical activity level to where then you can get back on land and start doing kind of some normal exercising or something like that. So tough case, tough situation.
Good question.
All right, we're back to the phone lines. We've got Dorothy on the line from Atwood. Go ahead with your question, Dorothy, for our therapist.
Yes, I have what is called rheumatoid arthritis in my ankle. I have a lot of pain. Is there anything I can do to relieve that? I am on a prescribed pain pill, but I hate to use it all the time.
You keep making me go first. You're like really quiet. So rheumatoid arthritis, any arthritic condition can be really painful. Unfortunately, you can't just cure arthritis. But the most important thing with any arthritic joint is to maintain range of motion, activity, flexibility. Again, if you can unload the joint, like Kerby mentioned on the last question, to get into the water, sometimes that can help make that movement more free, more pain-free. Rheumatoid, though, in particular, that's really a tough one. It can be really painful, and not a lot of things can help.
Rheumatoid, yeah, is a very painful condition. You think of osteoarthritis, where the bone is kind of degenerating or wearing out, so to speak. The rheumatoid is kind of the involvement of the synovial lining of the joint, which is very highly neurally innervated and just makes it very uncomfortable. So I think, yeah, kind of what to add on to what Troy said, although that joint is painful and it's uncomfortable, I think kind of maintaining or keeping the range of motion is critical at the point you're at. So kind of staying after it and kind of doing some maintenance work.
Good luck to you.
All right, we have just a few minutes left to the show, but we've got another caller waiting to ask a question. This will be our last call for the evening. Go ahead with your question for our therapist.
Hi, my name's Peyton Berger from Bueller, and I was wondering if, since I have constant headaches, would physical therapy help?
So I've treated a lot of people for headaches over the years. I'm sure Kerby has as well. Again, it would be what's causing the headaches. Cluster headaches is defining a certain type of headache, but there's still multiple things that can cause the cluster headaches. I guess I've found over the years a lot of times it's either an issue with a lack of joint movement in the neck or a muscle imbalance that has to do with maybe posture or certain muscle groups that just aren't strong enough, certain muscle groups that maybe don't have the right length to them. But all of those things, again, could be assessed by a physical therapist for you, and they could let you know what would be beneficial for you.
Headaches, yeah, those are very difficult to treat, mainly because there's several components of it. There's several origins that headache type symptoms can come from. One that kind of Troy was mentioning that we can really help with is like a tension headache or headaches that are stemming or originating in some of the musculature around the neck. One thing that I think is important and kind of sounds silly because it is so simple is with chronic headaches is trying to just be able to find some things that allow you to relax, kind of ease your mind, settle your mind, and reduce your stress. And sometimes some things as simple as that can lead to some great improvements with headache type pain.
We just have a little bit of time left, but you both talked a little bit about the imaging. How helpful is it to you for a patient to be able to bring in their MRI or their images to help you diagnose something?
Kind of depends on, I guess, where they're at. You know, if I have somebody that's just started to have some issues and they just want that first opinion to come in, I don't usually encourage the imaging. I don't think that should be the first step because it is expensive. It does sometimes show false positives. If they've been to PT for a while and things aren't better, or they visited with their family doctor and it's something that's lingered for a long time and they've tried multiple things, then yeah, imaging can be beneficial to maybe give you a little, number one, peace of mind that there's not anything worse going on there. And then number two, just to be another piece to the puzzle. You know, I alluded to it earlier, you have to find what the imaging shows, the positive findings, and see if that correlates to the symptoms that they're having. And then if it does, it can be very beneficial.
Okay, thank you very much for being our guest tonight. Troy Herrman and Kerby Rice were our guests talking about physical therapy tonight. On our next Doctors on Call, we'll be discussing cardiology. You can email questions to us for our next program at doctors@shptv.org. Thank you for joining us. For Doctors on Call, I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from Gove County Medical Center in Quinter, healing through caring. Blue Cross and Blue Shield of Kansas, serving approximately 950,000 Kansans in various programs. A value Kansans trust. Blue Cross and Blue Shield of Kansas, an independent licensee of the Blue Cross and Blue Shield Association.
Russell Regional Hospital, experts, neighbors, friends.